let's begin. It's a big day for India's fight back against the vaccine, and we'll be getting views from top experts from across fields. Let me first go across to Preetha Reddy, Vice Chairperson Apollo Hospitals Group. I'm also joined by Dr. Arvinder Soin, Chairman of Medanta Liver Institute. Welcome to both of you. We are going to be speaking in a while from now with Dr. Jayalal, the National President of the Indian Medical Association, which had written to the Prime Minister's office asking for the age of vaccination to be brought till above 18. They met with the Prime Minister as well today. We'll also be speaking with Dr. Shashank Joshi, member of the Maharashtra Covid Task Force. But let me go across first to Ms. Reddy, just to get an idea of what this means for private hospitals. What does this mean for large companies that have been saying that allow us to vaccinate all of our employees and their families? The notification says very clearly also that private hospitals will from May 1st get vaccines from the 50% dose or the 50% section that vaccine manufacturers have to give in the open market. It's no longer going to be from the central government's kitty. What does all of this imply, ma'am?
So I think to us, it's a great responsibility from the private sector, and there is a lot to be done. Let's be very clear and understand that many of the healthcare groups, and we have done a lot in preparing for it, whether it's the cold chain or locations where people can be vaccinated. And now that it has eased, the norm has eased that it can be 18 years and above, I think that's a great move for the country. And I really laud the Prime Minister and the government for really allowing this to happen. And it's actually come at the right time. I don't think we could have done it much sooner either. And then supplies are very important. And now that it has opened up, we have two confirmed suppliers, one more which will very soon be supplying. I think we're poised to really increase the numbers exponentially, because only if we are able to vaccinate a large population, and especially this population, because those who work, those who look after the vulnerable, all of them fall into this target group. So I think we need to do it. Our private sector has been gearing up. We as a group have, made plans over the past 6 months to really establish a cold chain, train vaccinators, not only within our own healthcare systems, for others. And then the large corporates have been, extremely forward thinking and come forth and said that, we can vaccinate large populations who are within their systems. We should also be able to vaccinate large residential localities. And I think companies like us have geared up, made plans, completely ready to roll this out. And I think that it came at a very opportune moment for us to really overcome the problem. There is a lot to be done. The target of 300 million to be done in the first phase and scale it up to at least 1 billion is challenging. It's a daunting task. So we need the supplies. We need to be able to procure supplies at the right time. And we need to be able to execute on this. And I think for all three, as a country, as a healthcare sector, private sector, we're really geared up to be able to do this.
Just one follow-up question very quickly before I go to all of our other panelists, Ms. Reddy. Since this 50% of how much ever the vaccine makers, the manufacturers make, can be sold to the open market and procured by state governments, and they have to announce what their price lists are, do you see this as a hindrance of any sort to actually procuring these vaccines for private players? Because the prices will, one assumes, be higher than what they are right now when the central government is getting the vaccines directly from the manufacturers.
I think there's a certain target group, and especially those who are employed, who will actually be able to afford this. And it's all about the right pricing, which I know that, companies which are producing vaccines are doing it more for humanity than anything else. So I think we will have like a pragmatic pricing policy. People will be able to pay for this, because this is honestly, in a way, it's life-threatening. And I feel there will be different mechanisms which will come into play so that people have access and will be able to afford this. Insurance, for example, will step in and pick up the tab for sure.
Yes. Yes, absolutely. The insurance companies will also come into play. Dr. Jayalal is with us from the Indian Medical Association. Dr. Jayalal, you were in that meeting with the Prime Minister earlier today. You've been writing to the Prime Minister's office saying, let's vaccinate everyone above 18. You and I have had the chance to have a conversation about this as well. Are you relieved today with this decision?
Thank you very much. I am much relieved. For the last 20 days, we are raising this issue and writing to the Honorable Prime Minister and the Minister. And not only me, there are various people who are involved in the COVID care as really raising the concern that the people should be immunized. Because we believe that that is only one tool which we can have, will be able to overcome the disease. Please look at the number. We are not talking that all the 100% people has to be vaccinated. What is our aim is even if it is 70%, if you are vaccination, then it will be a good enough to get a herd immunity. However, we must be taking into the consideration the people who are already infected. 1.7 crore is already infected. That means ICMR study says for every one person who is identified as infected, there is another hidden patients of nearly 30 will be there. So roughly around by this time, we will have around 30 crore people were already infected. So what the target which we need to fix is around 45 crores or to 50 crores. I think we have already crossed 12 crores. So it will be still possible for us when we are open up this strata. That is everyone who is above 18 will come in. The people will definitely come voluntarily to take the vaccine. Whether they can come into the private sector. When they are coming to the private sector, now already they are paying 250 rupees. And so even when the drug is going to come in the open market, and that is going to be of a great help for the country. Today the Prime Minister has very quickly taken the decision. And not only that decision he has taken positively, he has talked with the American president and able to get the consent of the importing of that raw material, thereby the enhancing the production of the material. And the new vaccines have been approved. The states are given the liberty to purchase the drug. And we were all asking for this, that the vaccine should come in the open market also. Because India cannot have only one system to follow everyone. The need and the way in which we can approach all the people are the different system. The multi-prong approach has to be there. And the government has taken the right decision. Now it is the job of the people. Those we have demanded for the vaccination, then now it is our responsibility to take part, handhold with the government and ensure that it is happening. Biggest challenge going to be not even the production, not even the manpower required to give that, the hesitancy. The social media, the infodemic, which is coming with all sort of news and messages which are coming against the vaccination, which we need to all united together, including all of our media colleagues. We need to unite together and curtail this and able to ensure the vaccine hesitancy we are able to overcome. And thank you for all of you for raising this issue, and thank you for the government for taking heed to the demands of the common man and the medical community on this issue.
No, absolutely. The government has got a lot of flack for a slower than expected vaccine program, and many have said that, if we had vaccinated faster earlier, maybe the second surge wouldn't have come. Maybe it would have, maybe it wouldn't have. We have no way of knowing. But the fact is that they've listened. They've responded. And Dr. Jayalal, you've given us a bit of news also when you've reported that Prime Minister Modi has spoken with, Joe Biden. Has spoken with the US president and tried to clear those roadblocks to the import of material required for the manufacture of vaccine. That's a very important input that has also come in. You spoke about vaccine hesitancy, and I think the best person to talk about this today is Dr. Soin, who's on our panel. Dr. Soin, good evening to you. This is something you have also pushed for, as have key people in the medical fraternity, and you're also living proof today that vaccines do work, isn't it? I'm speaking to you while you're going through your second round of COVID-19 infection.
Yeah, that's true, Tamanna. Basically, I had a mild bout of infection last year, and then I've had 2 doses of the vaccination, the last dose having been taken about a month ago. And now I'm positive for COVID again, but it's a very mild attack. I just have some mild sore throat and nothing else. So I'm absolutely fine. So we've always been saying that what vaccination does is prevent severe disease and death, fingers crossed. And that's what it's proving to be among all the healthcare professionals who've actually had it after vaccination. This whole this decision is a huge shot in the arm for the vaccination drive. And we are all delighted, and now we need to press on and expand it. And for expansion, the government has taken a lot of steps. I think they've injected some funds into the manufacturers' banks as well. And they have opened it out to the next set of vaccines, and we're all waiting with bated breath for the Sputnik, the J&J, the Novavax, and perhaps, if possible, Pfizer and Moderna. And all these need to come in. And I think that this will do our fight against COVID a lot of good. So my message as a person who's had vaccination and developed COVID after that is vaccines do work. I've just had mild disease, and hopefully I'll be through with it in a couple of days.
You know, that's a very important message, because people have been feeling that if, you know, they're hearing stories about someone who's taken the vaccine, has taken a single dose and then gotten sick, and then wondering then what's the point, etc. There is a point, because it does protect you from severe disease, and there is more protection from death, which is what is important right now. So as soon as you get the opportunity, you should take the vaccine. Before I come to Dr. Shashank Joshi, who was also in that meeting with the Prime Minister today, I just want to take you through some of this vaccine mathematics. Now, this is a report BofA Securities put out earlier today, Bank of America Securities put out earlier today, which talked about how the current capacity in India is 75 million doses per month, which is expected to expand by 50% from July. Serum Institute of India accounts for 91% of the vaccines that we're giving right now. Dr. Reddy's will import 250 million doses of Sputnik this quarter. And the ramp up is expected to go like this. Serum Institute will ramp up to 100 million by June. Bharat Biotech will ramp up to 12 million by July. Now, this is the interesting part. They've given us 3 scenarios. And the best case scenario, the bull scenario they talk about, is that we can end up vaccinating 48% of the population by the end of 2021. The worst case scenario is that we are stuck with 34% of the population. Dr. Shashank Joshi, how important is it to reach this best case scenario? What can you tell us about the important points that were made in that meeting with the Prime Minister today?
First of all, Tamanna, I think the opening up of vaccination is a big boost to the whole country, and it will generate more vaccine confidence. And particularly in the second wave, which is predominantly seeing these people between 18 and 45 being particularly affected. It's a very rapidly swarming strain, which is almost hit like a tsunami-like proportions. So that's something very clear. And I think we need to ensure that maximum people, and also there has been some degree of decentralization, and there has been an equitable distribution. Central will keep 50%, another 50% states as well as private players can enter. So I think there has been a fair amount of liberty given. Also, we are looking forward to many more fast-track approvals of vaccines, like the Johnson & Johnson vaccine, maybe Moderna and Pfizer also coming into place. And therefore, there will be a larger choice in the milieu of vaccinations in people who can access or afford it. At the same time, people who can't access and afford it also, they have been kept in mind, and they will also get the vaccinations. So I think the vaccine hesitancy should be stopped, and we should embrace it. Beyond that, of course, Honorable Prime Minister is concerned about the current grim situation prevailing across the country, but he's very confident, and he was very sensitive to what Dr. Jayalal said as the president of IMA, representing the entire medical community, because we can build a lot of infrastructure, we can get oxygen, we can get medicines, we can get vaccines, but we can't get people. And how to generate the larger healthcare workforce is the biggest challenge which the healthcare community is facing. And that's why, he's ensuring that we have to be positive and proactive, and various measures will be adopted. And all the suggestions were taken in a very positive note. And I am certain that under the leadership of the Central Ministry of Health, which is very, very proactive, with Dr. Vinod Paul from Niti Aayog as well joining in, they will take some very proper cogent measures so that we can break this chain of this current tsunami which we are seeing. And with some appropriate restrictions and containment measures, we will be able to come around it. As you can see now, Mumbai, Pune already are showing some signs of plateauing. And so, of course, it's a long way to go for this current wave, but I'm reasonably certain that we'll be able to break the chain in a very positive manner. And also, the triaging of cases, ensuring that most eligible people
Joshi,
get the
if I
bed.
just may ask you, I just want to get a take from you on vaccine, because you're on the Maharashtra Task Force, and now with this notification, it's been left to the states to decide who they want to vaccinate first. Now, from the 1st of May, going by the current capacities, etc., it's clear that there will not be a huge abundance of vaccines. There's 50% of the capacity which will be distributed among the states to do with it as they see fit. So states themselves will first have to go out and procure the vaccines as per availability from these manufacturers, because the central government will continue vaccinating only those 45 and above in government hospitals for free, as they have been doing. But the state governments will have to go and procure the vaccines, see how many they have, and then decide who to give it to. Here, what do you think should be the priority for a state like Maharashtra, which has the maximum number of cases? Can we open up en masse to everyone above 18 from the 1st of May, or will there be a further dissection of, which categories need to go first?
So I think very clearly inputs from public health experts will be taken. And I think currently, even now, the first strategy is to save lives. And in the Save Lives strategy, first is to ensure that all are vaccinated who are in the eligible group above 45. And below 45, all those who have comorbidities will get a priority. Because people who have comorbidities below 45 are more vulnerable to death. So first thing is save lives. I think that is going to be very, very clear, independent of the state or the center. Everybody is on unanimity here that in a very calibrated, systematic way, first thing is the most vulnerable ones who are likely to lose their lives will be vaccinated first. And the whole idea is to vaccinate people above 45 as fast and as early as possible. So this also allows a mechanism for the state, at least in the less exposed geographies. See, there are populations within the state which are heavily exposed to the virus, and there are populations within the state which are less exposed to the virus. We have seen in this wave, the less exposed population is the one which was vulnerable and caught the virus. And then that spread like a tsunami. So it is ensuring that we have to ensure that these seronegatives within the states are the ones who would be targeted. So each state and district wise, there will be a strategy which will be decided in a scientific basis. So here, a proper scientific rationale will be put in place by each state, each district, and the most eligible and the most deserving will be vaccinated. But also a opening has been made for people between 18 to 45, because remember, these are the most productive people. They are also running our economic engine, and therefore workplaces also have been permitted now. A couple of days back, we have to congratulate a decision of the central government that they have allowed vaccinations to be done at the workplaces. And therefore, lot of workforce which is there at the population, which is likely to get infected, they will also get vaccinated. And lot of people who are between 18 to 45 in that workplaces, the people who are having those corporates, they will be able to buy the vaccines from the private sector and vaccinate their population. So I think it is a very appropriate gesture, and I am certain that it will be used in a very judicious, appropriate way so that the maximum possible protection is conferred in that geography and that population.
I want to talk a bit about what this judicious way would be. And Ms. Reddy, I want your thoughts over here. Do you agree with Dr. Joshi that first, the next in line ideally should be those below 45 with comorbidities? How will we ensure that this is, properly distributed, because states will now have that responsibility, private companies will also tie up with vaccine manufacturers. And do you think there is a case for concentration of vaccination in areas where there is higher infection?
So I think the best way for us to look at it is first, look at the population which we have. There's a certain group, as he said, which are seronegative. You might want to really pick up that population and vaccinate them. The other group are the ones who are, either handling elders or living with older generations, because, then it makes them more vulnerable. So those are the groups, again, which are the target population. But the permission to really go to workplaces and vaccinate that population, whether, it's large employers, it's large corporations, I think will make a huge difference, because then you've taken care of a certain population, which is again a targeted group. So literally you can't boil the ocean, but we need to pick up target groups who to us will either be the most vulnerable or the spreaders of the disease. I think you need to look at both of them, target this population, do it as quick as possible, and that's probably the fastest and the most sensible way to handle this. Again, I think, procurement, the cold chain, and the operational efficiency is the key, and we have to really gear up to be able to do that. And whether everybody has the right cold chain in the private sector in place, how much of the government and private sector can work together, because now we're not on two sides at all. We have to make a concentrated effort, and I think so far the government has been phenomenal in the way they've helped us overcome each challenge by challenge. So again, we have to just work together. The target population again becomes vital, and it has to be the vulnerable, the ones who are most likely to spread the disease, and those who are concentrated in large areas, whether it's, groups who are living together or groups who are working together. These are probably the ones we should attempt first.
Dr. Jayalal, in your view, how do you think this distribution should take place? Because one can be fairly sure that from the 1st of May, there's going to be a scramble to get the vaccine. You've flagged off concerns about vaccine hesitancy. Maybe in some pockets there are. But anecdotally, you see, the more infections rise, the more people want to rush out and get vaccinations. So do you think there is now a case to figure out state by state that who gets it, and what will be the role of the private sector over here?
Yes, we see India is, equipped enough to face many of these challenges, including the election. That we have a system where each area is allocated for the entire population of that state is able to come and vote on a particular day. And something similar to that can be definitely exercised in the healthcare system also, because Indian healthcare system has much used up to the immunization schedule, because every sub-center, every primary health center, and almost every private hospital is also equipped enough to do the immunization schedule, and there is no absolute difficulty. One more advantage which we get with this is when you are taking away this strata, one of the concern we had is the vaccine wastage. See, once it's a 10-dose vial, we open up for the people. That is, if it is as per the criteria, 45 age above, only 5 people will come. The rest, the government is very strict that you cannot use. So it goes on a wastage. Now the hospital or the center which are giving vaccination is at the liberty. Anyone who walks in will be able to given. So absolutely we will be able to overcome the wastage also. It will be overcome. And we have each ration shop of the public distribution system where we have a very, very methodological way of particular street, particular village is coming and taking the vaccination. So definitely our public health system will be able to come to the level of distributing it. As rightly said by both Madam and Shashank, that is once you are going to a factory where there is more than 100 people are there, now once you are taking away the age restriction, everyone can be immunized. That is becoming a very easy problem. It is not that people need to come to us. The next step, we will see to that we will be able to go to their nearby school, nearby street, nearby Anganwadi center, and we will be able to conduct the immunization schedule. Absolutely, the healthcare system will take up this challenge. We will be able to do very positively in this, and we will be able to reach the target of 48 million, what you are saying, that definitely 48% of the vaccination will be possible within the 2021 target which we are fixed today.
Yeah. Dr. Soin, in terms of priorities, now how do we ensure, because remember the whole theory for keeping the vaccine distribution so curbed, and across the world it's fairly curbed. It's the central government who looks at it. I think there would be very few countries where private entities in the open market is allowed to deal with the vaccine manufacturers directly. It's all through governments, either state, central or federal, depending on the structure. How do we now ensure vaccine equity in this manner at this time? Because if the priority is to vaccinate those below 45 with comorbidities, they may not necessarily be people who can afford to go to a private hospital to get vaccinated or work in a large company who will vaccinate them or their family.
I think the government, by their decision of keeping 50% of the vaccine stock for themselves at the center and the remaining 50 being distributed among states and the private players, have actually taken care of that. Because what that amounts to is that nearly 60 or 70% of the vaccines will be either free or subsidized, because they'll be given either by the central government or the state government. So you're really talking about selling about 20 to 30% of the vaccine stock, which is absolutely fine, where people can actually afford to pay for it. Now, in terms of equity, that's one of the ways of ensuring it. The numbers that they have actually decided on are very logical. The second thing is that the suggestion that those who are seronegative should be given the vaccine is a very nice one. I've been thinking of it since last year. But the problem is logistic, which means that it'll cost about 250 rupees to do each antibody test, and there has to be an extra visit. I'm not sure this can be done at your doorstep or people's homes, or maybe there have to be camps, then there is spread of COVID. So there'll be a logistic issue there. But yeah, of course, if 30 crore people have had it, it makes sense to give it to the others. That's obvious. And I agree that the people with comorbidities between the 18 and 45 age group, which I believe will be in the region of 2 to 3 crores, would be the next vulnerable group that should be given the vaccination. And if there is leftover, then of course the central government has already given its word at opening it out to everyone. Then the others should be serviced.
The vaccine process is effectively being unshackled today. Ms. Reddy, is the private sector geared up to handle the flow which is going to come? The distribution pressure, the actual training of enough people to go out and do this. Imagine when it was, when we opened up to those above 45, in a few weeks we felt that there was a shortage of vaccines when people started flocking to get themselves vaccinated. When you open up to everyone else, in terms of all adults, we can expect much, much larger numbers. Are we ready?
So I think we have to be ready. Let me put it this way. We don't have too much of an option. And for that, we've been preparing over the past 6 months within our institution, and many others are doing the same. So if we open up centers, if we can do mobile vaccination clinics, if we can train enough people to do the vaccination, and if the procurement and cold chain is in place, I think we should be able to do it. A country, America has kind of done it to a large extent. India has shown the way that, we are the world's largest in terms of production, speed. In fact, we vaccinated faster in actual numbers than the US has. So I think if all this comes together, which I'm very sure it will happen, we should be able to do it. So centers to vaccinate have to just increase exponentially. People to do the job have to be trained, and that should be done. Procurement, I think, now has opened up. So we will have more than what we had earlier. And the cold chain and logistics has to fall into place, which I think plans are afoot within our system, which, where I work for. But throughout the country, I think different providers have actually started planning this. So I think it will all come together definitely. I'm sure about it.
Right. Like you said, we really have no option. This is our chance. We have to fight back. There possibly may be some teething troubles, but sooner or later we'll make it. At least it's an option now that you will have vaccine for all. If you get a chance, take your vaccine. Thank you so much to all of you for joining us on this special show this evening. We'll take a very short break. On the other side, you will hear from Maruti boss R.C. Bhargav on the ongoing COVID second surge.